Do you know the best strategy to pass NCLEX exam? It is the nursing process. All of the questions will be coming with nursing process steps. So we should learn how to apply the nursing process to answer each question. In this video, I am going to explain about nursing process. Nursing process include 6 steps: assessment, diagnosis, outcomes, identification, planning, implementation and evaluation. Ideally, this is an integrated process. That means not only one assessment include. It includes assessment plus following, diagnosis, outcomes, planning, implementation and evaluation. Most of the questions comes like the patient will have an assessment, then planning, then evaluation. Few questions comes like assessment and evaluation. Then some set of questions will be like assessment and implementation. Some of the questions come with assessment and prioritization. We can see one in this video how it apply. What is nursing skill? It is the capacity of a nurse to do clinical judgment of her patient. That's we call as nursing skill. If we fail to do a clinical judgment properly, fail to do the rest of the assessment also. The clinical judgment skill of a nurse is recognizing the cues when doing an assessment. So she must be recognizing what is the significant findings, most important and of immediate concern. When she realizes these cues, she is doing a clinical judgment. Let's look one of the assessment question. The nurse is assigned to care for 4 clients. In planning client rounds, which client would the nurse assess first? It's an assessment question. Let's see the options. A post-operative client preparing for discharge with new medications. Second option, a client requiring daily dressing. Third option, a client scheduled for a chest X-ray after insertion of a NG tube. The fourth question, a client with asthma who requests a breathing treatment during the previous shift. So here, out of this 4 patients, we have to find out which one is the priority. So the nurse assessment starts from here. Assessment is gathering the data and then recognizing the cues. Then after that, we are identifying the problems and forming a nursing diagnosis by analyzing each of these cues, and then we are prioritizing the hypothesis. Let's see how this works. The first option is a post-operative patient is discharging with new medication. The second one, a patient for daily dressing. The third option is a patient after the insertion of NG tube waiting for a chest X-ray. The last one is a patient is requesting for breathing treatment from the previous shift. Analyze cues. What does the data mean? What is expected and unexpected for each of these patients? We are going to find out what is normal and abnormal for this patient. I am going to make a clinical judgment according to their conditions, the life process, or we are going to check the vulnerability of the patient and forming a hypothesis, diagnosis. After our analysis of each patient, the ABC comes first: airway, breathing and the circulation. In that, the airway is always the highest priority. This will direct to the answer. The client with asthma who requests breathing treatment is experiencing breathing difficulty. The other clients are not of immediate priority. Prioritize hypothesis means what hypothesis should receive priority attention? That is the question here. We are ranking the client conditions and problems according to urgency, complexity and time. This is what prioritizing leading to a planning process. The clinical judgment skill of the nurse here is prioritizing. The content area is leadership management prioritizing, because she had 4 patients with 4 different conditions. So she is the leader of all these 4 patients, and we can conclude that it is from the leadership management prioritizing. And the priority concept is care coordination and the clinical judgment. The client need is a safe and effective care environment.